Good morning, good morning. This one. Good morning, long reachers and non-long reach members. Good morning. Even if it's good evening, we always say good morning in long reach. There's something wrong with this phone of mine. So let us remind one another that training is about to start. Good morning, great leaders. Good morning. Good morning. Let's please invite our people. Let us share the link. Again, as usual, we share the link with our partners. Hey. This thing. Yes, let's share the link. Say good morning, good morning. Let's know who's watching. Let's know who is watching. Good morning, Leader Tozama. Welcome, leadership. Welcome. Let's send the link to the respective groups, your prospects, or whoever you want to add. Good morning, good morning. I see the numbers are picking up nicely. And I'm sure that you can hear me, right? I'm very sure that you can hear. Leader Elinya, good morning from Togo. Good morning. Let's please, you know the drill. We send the link to our respective groups, our partners, maybe our prospects, I don't know. But let's please welcome them at Siriso from Palapye. Where's Palapye? Is it in Limpopo? Yes, let us send the link. Good morning, Leader Dozy. Good morning. We will start in 2 minutes. Let's just send to the respective groups. If a person has a heart, they need to be here. Even if it's that one, the clock, they need to be here. Let's share. I'm also sharing on the groups that I'm in. Remember, I said we're starting at 5 past. Welcome, product specialist in training, Leader Tanya. Welcome. Let me actually share it in the academy as well, Tanya. Hey, thank you for coming on board. Remember, I said we're starting now at 5 past 7, so we've got a minute to go. Let us send this link to everybody, everyone who is everyone. Welcome, great leaders. Good morning. Thank you so much for availing yourselves. You know what? Let me do this. Simple as this. Let me do this. We've sent ne? It's almost 5 past. It's almost 5 past. It's 5 past already. We've sent, right? To our respective partners. Good morning, Leader Katie. How? Coach Naftali, welcome. Leader Onalin now, welcome. Leader Matabang, welcome, great leaders. Welcome. Actually, this is training, even if it's a show. Remember, we have our pens. Leaders need to always be prepared. We have our pens, we have our diaries, right? We have our diaries. Please, never ever attend trainings without a pen and something to write on, preferably a book. All right, let us begin, great leaders. How is everyone? By the way, today it is officially 3 years that I'm in this business. I joined Longreach on in 2018, September the 27th. So on this day is my anniversary of 3 whole years in this business. Isn't that amazing? Lidan Saki, welcome. Welcome. Didn't just say. Welcome, leader. So pen and a book where you write info, right? Okay, so it's now 7:05. Well, it's now 6 minutes past 7. Remember, this is a class, so around quarter to 8, 5 to 8, 10 to 8, quarter to 10 to 8, I will give the floor over to you where you can ask questions. But you can go viral in with the small one. But you can comment as much as you want. Just say fire. I want to see is everyone prepared. Fire! Yes, it's a happy anniversary. I'm happy. I'm wearing my happy color yellow. I'm wearing my happy color yellow. I went and printed this shirt today to celebrate my anniversary. Yeah, thank you, babe. Yes, fire! Welcome, leaders, the pop coach. Yes, fire, 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 fire. Yes, it's this shirt. You see, I'm short. Ish. You see, it's the woman you are. Kind, loving. Yes. Within fire. All right, my leaders. For those that have just joined, welcome, Leader Muzi. Leader Tunyisa, pen and something to write on. Then around quarter to 8, 10 to 8, I'll give you the floor. But feel free to keep on commenting. Let me read about the heart. And I hope we've all taken all of the water that we need because wow. So, ladies and gentlemen, start class is in session. Now, let's talk a little bit about the heart. The heart provides the power to your life, pumping 90,000 times every day. Your heart pumps 90,000 times every day. Ironically, it can also be one of your greatest weaknesses. Almost 1 in every 5 deaths in South Africa, 1 in every 5 deaths in South Africa are caused by heart diseases. Only HIV and AIDS claims more lives nationally. These are South African stats. Okay, I'm reading from the Heart Foundation, okay, the Heart and Stroke Foundation, South Africa. So, heart disease often progresses suddenly without any symptoms or any warning until a heart attack suddenly strikes. By living a healthy lifestyle and understanding your own health, you can prevent heart disease or treat it early before it is too late. Remember that song, Too Late for Mama? 80% of heart diseases that happen before the age of 65 years can be prevented by eating well, keeping active, and not smoking. Please write there, no smoking under any circumstance, even secondary smoke. In reality, though, the lifestyles of most people living in South Africa are becoming unhealthier. 2 in 5 South Africans have high blood pressure. Please write that down. 2 in 5 South Africans have high blood pressure. 2 in 3 women are overweight, and a third of men smoke. Nearly half of the population is unfit. We don't want to exercise. And most eat too much salt. Zipo, Mina now, we are too much salt. Most eat too much salt and not enough fruit and vegetables. Start living a healthy lifestyle to prevent developing heart disease or having a stroke and to live a long and active life. We are together, ne? Some less common types of heart disease can develop before birth. So before a child is born, they already have a heart a complication. It can be inherited from parents or result from an infection. So let's look at types of heart diseases. I won't be too technical, but maybe I'll touch on 3 or 4. All right. So types of heart disease. The human heart is a muscular pump that keeps blood flowing around the body. It accepts blood from the organs and tissues and pumps it to the lungs to be enriched with oxygen. So oxygenated blood. The blood rich in oxygen is returned to the heart and is then pumped to the tissues of the body to supply them with oxygen. Have their oxygen. Let's see. Are you paying attention? Blood filled with carbon dioxide and waste products are circulated away from the tissues to be cleaned. So now, diseases of the heart and blood vessels. The human heart will beat about 3 billion times from birth to the age of 90 years. 3 billion. Along the way, many things can go wrong with the human heart, including with the heart muscle itself, all right, the heart muscle itself, with the valves that help blood flow, with the heart rhythm, and with the blood vessels that transport the blood. Hey, the heart cannot function at its best without a healthy network of blood vessels that carry the blood away from the heart and back to the heart again. These blood vessels that carry blood are called arteries and veins. All right? These blood vessels that carry blood are called arteries and veins. Diseases of the heart itself and the blood vessels are together referred to as cardiovascular diseases. So CVD. It's a group, cardiovascular diseases. Heart diseases can be caused by genetic factors. So it can be something hereditary that you got from your parent, one of your parents, lifestyle choices, birth defects, infections, or a combination of factors. Some common types of heart disease. Uh, there is something called venous thromboembolism. Venous thromboembolism. It is a blood clot formed in a vein, all right, and can travel in the network of blood vessels until it blocks a blood vessel. Deep vein thrombosis occurs when a blood clot blocks a vein, typically in the leg. Pulmonary embolism occurs when a blood clot travels to the lungs and blocks the blood supply to a part of the lungs. Blood clots can be triggered by medical procedures, one, or by other medical conditions, or by periods of immobilization, such as lying in a hospital bed or long flight. Blood can also clot easier in certain hey, such as cancer. All right, let me read this again. Blood can also clot easier in certain medical conditions, such as cancer and autoimmune disorders, with medical treatments, with hormone therapy due to inherited conditions, and with increasing age. So, age is also one of the factors. Then there's another heart disease called peripheral artery disease. For those who were watching last week when I was talking about the eyes, remember I said peripheral vision is what? Your side vision, your side eye. So this is quite similar to it when you listen to the explanation. Peripheral artery disease is a narrowing of the arteries that transport blood to where? The legs, stomach, arms, and brain. So, all right, legs, stomach, arms, brain. All right. Similar to what happens with ischemic heart disease, atherosclerosis causes gradual buildup of plaque in these arteries. Peripheral artery disease often occurs in the legs, where the blood flow and therefore the nutrient and oxygen supply to the large leg muscles are restricted. This can cause pain, cramping, and weakness in the legs, especially when the leg muscles are engaging in exercise. As peripheral artery disease worsens, it can cause more serious damage, such as gangrene and amputation. So they cut that thing. Similar to atherosclerosis that affects the coronary arteries, peripheral artery disease can be prevented and improved by healthy living. So this is why they also say sitting is the new smoking, because you are just in a stationary position for a long time. So you need to, especially for those who work sitting for a long time, you need to stand up every half an hour, just walk for about 2-3 minutes, just walk to get the circulation going. I hope we're together. All right, then there's something called cardiomyopathy. This refers to a collection of diseases that affect the normal functioning of the heart muscle itself. The heart muscle can become abnormally enlarged, too rigid, and weakened. It can lead to heart failure, an abnormal heart rhythm, or in some cases, cardiac arrest, so heart attack. There are many types and causes for cardiomyopathy, from inherited disorders to cardiac myopathy caused by other illnesses or Lifestyle factors. We always go back to lifestyle. The severity of the disease and the treatment options depends on the type of cardiomyopathy. And let me read this last one. The others, I'll just name them without going deep into them, all right? Then there's something called angina, which I've actually seen happen right in front of my eyes from a colleague who collapsed at work during shutdowns. Angina is a symptom usually caused through coronary artery disease. Angina is chest pain, all right, or discomfort, which occurs when not enough blood flows for the heart muscle to function effectively. The cause is usually narrowing of the coronary arteries, but in an angina attack, heart muscle damage does not result. Thank God for that. Though it's very painful. The pain is usually felt in the center of the chest and may spread to the arms, the neck, the jaw, and the back. It is usually a constricting pain. So, like you are immobilized, NG. Like, people who have panic attacks, you just don't know. Yeah, you can't do anything for dear life. So, it's usually a constricting pain or tightness, which may restrict breathing. Sharp stabbing pains on the left side of the chest are not due to heart disease. Stable angina is triggered by exertion, such as exercise, which increases the work rate of the heart, thus leading to a greater demand for oxygen by the heart muscle. Resting or prescription medication usually reverses these symptoms. Unstable angina happens at rest and can become progressively worse. If you regularly suffer angina but you think it is getting worse or more frequent, you should contact your doctor. All right. If you have never had angina before and experience chest pain, you should follow the advice for a possible heart attack. So it's angina and then heart attack. I hope we are together. Then let me start from the top. I said venous thromboembolism, that's the first one, types of heart diseases. Then I said it's peripheral artery disease. Remember, I kept on doing this. I do this so that it sticks in your brain. Okay. Cardiomyopathy, and then I said angina. And then the other ones, common types of heart disease are atherosclerosis, heart valve disease, then something called Kawasaki disease, rheumatic heart disease, congenital heart disease, arrhythmia, cardiac arrest, heart failure, heart attack, ischemic heart disease. Those are just some of them. Those are the common ones. I hope we are together. Né? So that is the types of heart disease. Moving on to signs of a heart attack. So signs of a heart attack. Not all people experience the same symptoms when they suffer a heart attack. Sudden chest pain is the most common symptom of a heart attack. In some cases, mostly women or people with diabetes, please write this down. In some cases, mostly women or people with diabetes, a heart attack can happen without any chest pain. So in J, it's just sudden. Chest pain can also be caused by several other conditions that affect the stomach, chest wall, muscles, or lungs. Ambulance staff or a doctor can do the necessary tests to find out if chest pain is caused by a heart attack. All right. These are some of the symptoms of a heart attack. Please let's write them down. Right. The first one, symptoms of a heart attack. An overwhelming sense of anxiety. An overwhelming sense of anxiety. So too much, NJ, you are even sweating. Yeah? That's the first one. Second one, shortness of breath. You know you don't have asthma, but NJ, all of a sudden, NJ, like a panic attack, right? Shortness of breath. Number 3, feeling lightheaded and dizzy. Feeling lightheaded and dizzy. Are we still together, leadership? I'm back on the screen. Okay. Are we still together? I was on number 3, feeling lightheaded and dizzy. You are writing these down, right? Can I please get together that I haven't lost you. together. Cool. Thank you, coach. All right. Okay. The fourth one, abdominal pain, feeling sick, or vomiting. Remember, we're on symptoms of a heart attack. These are some of them. So, abdominal pain, sorry, feeling sick, or vomiting. Oh, sorry. The first one, the pain can spread to the shoulders, the arms, neck, or jaw, and sweating out of the blue. We know it's hot, but it's not that hot for you to sweat as if like there's a heater right here. All right. And then the other one, the last one, chest pain that could feel like pressure, tightness, discomfort, or squeezing. Like you feel like they put a 12.5 of a what you call it of Iwisa. That kind of. Ne? We need to be vigilant leaders, and too many people are dying from heart disease. This is why I'm getting a little bit deep in it. So those are the signs of heart attack. Now, what are the causes? What are the causes of heart disease? So, as I said before, heart disease includes a wide variety of conditions that can be caused by a wide variety of different factors, right? Specific types of heart disease, such as rheumatic heart disease or congenital heart disease, have specific causes, such as an infection or birth defect. Right? So, rheumatic and congenital heart disease have specific causes, such as infection or birth defects. However, most cases of heart disease develop due to gradual damage to the heart and the blood vessels. Please note this: gradual damage to the heart and the blood vessels. Remember when I started first with the heart, there's somewhere where it said sometimes there are no signs. It's sudden. This is why we need to adopt a healthy lifestyle. All right. In this case, heart disease often does not have a single cause, but let me see. Yeah, gradual to the heart and the blood vessels. In this case, heart disease often does not have a single cause, but rather many factors that together increase the chance of heart damage and eventually result in heart disease. These factors that do not directly result in heart disease but contribute to its development are called what? Risk factors. Right? These factors that do not directly result in heart disease but contribute to its development are called risk factors. The more risk factors you have, the more serious the individual ones are, the greater the chance of developing heart disease. So, risk factors are grouped into two: uncontrollable risk factors and obviously controllable risk factors. Let's start with the uncontrollable. So, some risk factors are out of your control, but can still make heart diseases and strokes more likely. Even though you can't change them, you should still be aware and control what you can. The most common uncontrollable risk factors are, there's 5 of them, right? Uncontrollable risk factors. You are writing again, uncontrollable risk factors for heart disease. Number 1, your age. Heart become more likely with age, so the older you get, all right? And then your gender. Women are slightly protected against heart attack before menopause, but then their risk increases afterwards. So after menopause, it gets real. Women are also less likely to service a heart attack, and the signs of a heart attack may be less obvious. So age and then gender. Those are the things that you cannot control. The third one, genes, your genetics. Rare forms of inherited heart conditions, high cholesterol, or high blood pressure can increase the risk of heart disease and strokes. So, age, your gender, your genes. Fourth one, family history. If your father or brother suffered heart disease before the age of 55, or your mother or sister before 65 years, then you could also be at increased risk. Let me repeat that again. If your father or brother suffered heart disease before the age of 55, or your mother or sister before 65 years, then you could also be at increased risk. All right. And then the last one, poverty. It's written, it's not me. Here it is. Poverty. Poverty can increase stress, anxiety, and depression. Healthy lifestyle choices could also not could also not be affordable or available, and good medical treatment could be inaccessible. Therefore, poverty is an important risk factor for heart disease and strokes. Now, in Longlish, what do we say? We're trying to build generational wealth. We're trying to get rid of poverty. So now you have a medical reason why you must also, besides bank balance, we don't want people to have what? Heart conditions. It's a risk factor. All right. So yeah, there's 5 of them. Uncontrollable risk factors. It's age, gender, your genetics, family history, and poverty. I hope we're together. And then controllable risk factors. There are 10 of them. Yeah, there's 10 of them. Controllable risk factors are factors that increase your risk of heart disease and stroke that you have the power to change. Even small improvements in each of these can make a very big difference. So, what are these things, the controllable factors? The first one, pollution. Can you believe it? Let me go back to you. Pollution is a controllable factor. Thank you, Leader Pindile. Pollution. I think we are writing everything down. We wrote the uncontrolled, now we're writing the controlled. So pollution is one of them. It's the first one. Who can run away from pollution? Nobody. Second one, stress, a controllable risk factor. Stress, smoking, nutrition, so diet as well. Physical activity. Are you exercising or not? Are you exercising enough or not? Body weight. That includes BMI. Alcohol use. Number 7. 8. Diabetes. 8 is diabetes. 9 is cholesterol. And the 10th one is blood pressure. I hope I didn't lose anyone. Did we write all the 10 controllable risk factors? First one, stress, smoking, nutrition, or you can write diet, physical activity, body weight, alcohol, diabetes, cholesterol, blood pressure. Did we write all the 10 down? We wrote all the 10 down, ne? Remember, now we are checking who's our customers. You see how many customers we've got? We've got a lot of customers. You wrote all the 10 down, right, my leaders? As I continue, so we just did causes of heart disease, and now treating heart disease. Heart disease can present at birth, develop gradually over many years, or happen suddenly and unexpectedly. For most types of heart disease, there are several treatment options available. Treatment can broadly be classified into medicines, devices, and surgical procedures, and lifestyle changes. Often, different types of treatments are combined. So, when we speak about medications, many medications are used to treat and prevent heart disease. Here are some examples. Blood pressure medications improve blood pressure, okay, to avoid heart disease, kidney disease, and strokes. Blood pressure medications improve blood pressure to avoid heart disease, kidney disease, and strokes. Cholesterol medications reduce atherosclerosis. Remember, it's buildup of plaque in your arteries to prevent coronary heart disease. So that's cholesterol. Clot busting medications are used to dissolve blood clots that block arteries or veins. And then medications can improve blood flow to the heart or other organs. Medications can improve the rhythm and strength with which the heart contracts. They can help the kidneys to remove extra fluid buildup from the body. And then anticoagulant and antiplatelet medication can prevent blood clots from forming. Just from reading that last statement, when I say anticoagulant and antiplatelet medication, which product can you think of right now? This one is an easy one. Which products, when I talk about anticoagulants and antiplatelets, which products? That one is a giveaway. If you read the slides, not even my PDF, just that long list posters, it's there. It's it's there. Which product, my leaders? Fiona, unfortunately, that's not the right one. That's not the right one. But on the PDF of long reach, I'm waiting. I'm waiting. I'm waiting. I'm waiting. It can only be there's so many of you in class. Which product? When I talk about anticoagulant, oh, you're going to your archives. Anticoagulant and platelets. Which product? Hmm? Which product? Which product? Remember, you also need to learn. These are some of the things that you actually need to remember when you are, what you call it, when you are by the street. I, Osrifi. No, good try. But brown tea is super for the heart, but it's not that. It's not that. Uh, my leaders, really. Thank you, Tanya. Berry oil. And remember, berry oil is on special right now. Buy one, get one free. Oh. So berry oil is the product that you need to give to anyone with cholesterol, high blood pressure, cholesterol, high blood pressure, sugar diabetes, kidney disorders. Berry oil is the go-to supplement. Berry oil is the go-to supplement. Thank you. Thank you, Leader Hamim. The correct answer here was berry oil. Okay. Yeah, making sure that you're paying attention. Let's see. Okay, these ones are a little bit technical, but let me just read the lifestyle changes. Up to 80% of heart diseases that occur before the age of 65 years can be prevented by a healthy lifestyle. Living healthily can even help to treat many cases of existing heart conditions, such as heart failure, atherosclerosis, and coronary heart disease, just from eating better and exercising and walking. So, living with heart disease, let's say you've got you have a heart condition or somebody close to you or a neighbor. Okay, heart disease has many lifelong implications. After a heart attack or surgery, there is a recovery period and rehabilitation is needed. For many types of heart disease, there are ongoing symptoms that require ongoing treatment and changes in lifestyle. An important part of living with heart disease is to prevent existing heart disease from worsening and causing further cardiac events such as heart attacks or stroke. Mm, yeah, ne? You go through the most. So I'm gonna go through frequently asked questions. all right, on this website about heart disease, just so that we are together. Um all right. Heart conditions develop due to different reasons, and although poor food choices are often one of the contributors, it is not always the case. However, after a heart attack or heart surgery, it is always important to eat a heart healthy diet to protect your heart and blood vessels from further damage. All right. This is on how should I be eating after a heart attack or heart surgery for people who have had heart attack or surgery. So, a healthy heart diet should be tailored to your risk factors for further heart disease, including high blood pressure, high cholesterol levels, being overweight, or other medical conditions such as heart failure, diabetes, kidney disease, etc. If you have existing heart disease, it is highly recommended that you make that appointment with a dietitian to discuss your current eating habits and to receive individualized advice. All right. Ask your doctor to refer you to a dietitian or find one on the website of Heart and Stroke Foundation. Now, can I still exercise after a heart attack, heart surgery, or stroke? Not being active is one of the causes of heart disease and stroke. Remember, sedentary lifestyle, you're stationary, you're sitting the whole day. That is a risk factor. Once you have recovered and are stable, exercise can help to avoid another event. Ask your doctor when you can start and how much you can do. A biokineticist can structure a gradual reintroduction of exercise and provide supervised exercise sessions. Right? Take it easy at the start, build your activity up gradually, and stop if you start to feel unwell during exercise. And then the last one, can I have sexual intercourse after a heart attack or heart surgery? Sex has a similar effect on the heart to exercise. So, yeah, sex and exercise, the same on the body. Many people are scared of resuming sex after a heart attack or surgery for fear of another heart attack or chest pain. Some people with heart conditions needlessly avoid sex, whilst others with unstable disease or severe symptoms should wait until they are more stable. The biggest problem is that sex is often an uncomfortable conversation that neither the doctor nor the patient want to start. Yet your doctor can provide the most suitable advice relevant to your medical condition and recovery. So don't be shy to ask. All right. Hope we are still together. Now, there is something, my leaders, that I would also love to enlighten you about. Okay, we all know, well, I hope we all know, that we need to eat right, and the Heart and Stroke Foundation have, there are some food, né? Some kind of food that have the Heart and Stroke Foundation, the heart, the red circle with the heart, and the DSA, Diabetes South Africa mark for those who are diabetic. You need to also look into that if you are high risk for, heart disease, or if you are diabetic or in risk of being diabetic. I think there's pre-diabetes, there's different types of diabetes. I hope we're still together. Né? The one thing I would love to speak to ladies and gents about, the vaping. Do we know what is vaping? Do we know what is vaping? Class is still in session. My students are not answering. Do we know what is vaping? You know that electric cigarette and the Hablis. Okay, leader Ufwamo, leader Ntswaki. And just all right, let me type vaping. I'll just say, do you know what is vaping? How? Where is it? vaping. Yeah, like that. All right, it's sending. China, yes. Ngao, yes. Here this is all over USA. Leader Richard, even in South Africa. You'll find like normally youngsters, 20s that I've seen, they'll be busy with this thing that will be having, is it steam or what is it? And they're all sharing and passing it around, even during COVID time. Yeah, guys. All right. So just go vaping and it will show you what is vaping, okay? So, what you need to know about vaping. The truth, let me just check this. Okay. The truth about vaping is still very much up in the air, as the studies haven't been able to run for long enough to be conclusive. This said, there are many things which have demonstrated that vaping is far from benign. It might be healthier than smoking, but it might also be far, far worse. We just don't know. Right? This is what we know about vaping. Ladies and gentlemen, I am still reading from the Heart Foundation website. Okay, so vaping full consequences are still unknown. So, a recent study found that smoking cigarettes decreases the gene expression of 53 genes that play a part in fighting viruses and bacteria. Right? So, smoking decreases a certain gene, gene 53, that play a part in fighting viruses and bacteria. Right? Vaping affects an astonishing 358 of them. When smoking affects 53 genes, vaping affects an astonishing number of 358. So that's like, wow, to the power of I don't know what. What's scary is that we have no idea what this actually means. Remember, vaping is a new trend. It came about when some 2 years ago, 3 years ago, that's when I saw like people prior to COVID. Vaping will affect your breath. Vape contains propylene glycol and nicotine, both of which remove moisture and stop saliva from being able to wash away bacteria associated with halitosis. For those who don't know what is halitosis, it's just a nice term of saying bad breath. All right. So uh, vaping contains propylene glycol and nicotine, which remove moisture and stop saliva from being able to wash away bacteria associated with bad breath. The nicotine also restricts blood flow throughout your body, your gums included. This increases the risk of developing gingivitis, and periodontitis. This is just all from vaping. Vaping has been linked to hair loss. Nicotine increases blood pressure and restricts blood vessels in your scalp. Hair follicles are deprived of the necessary nourishment needed to grow healthy hair. Vaping has been found to directly affect the epithelial cells, which play a key role in healthy hair growth. So if you see your neighbor, they had nice hair before vaping, and then all of a sudden it's a sad story. Vaping is might be the cause. Vaping has sadly also reversed the decline in nicotine usage amongst the youth. Have you seen? It's the like I said on my side, I see the youngsters, a lot of youngsters doing this vaping. Vaping poses a serious risk to teenagers, right? Remember, we said they're the ones that, yeah. The teen brain is extremely receptive to the effect of nicotine, the teen brain, the teenage brain. Those who start early have deeper addictions and more difficulty quitting. Vaping's flavors, e cigarette design, and clouding culture are all brilliantly designed to appeal to teenagers. Mm. To the men, vaping is linked to ED, erectile dysfunction. Yep. The nicotine in vape juices is a something called vasoconstrictor, meaning it constricts blood vessels, reducing blood flow to your extremities, including the penis. The higher the intensity of nicotine intake, the greater the degree of erectile dysfunction. Prolonged heavy use can cause permanent blood vessel damage. Oh, so permanent local is like, yeah. Oh, my goodness. All right, so I'm going to read the rest without getting too deep into it. Secondhand vape is also dangerous to everyone, just like secondhand smoking. Vaping poses a serious risk of poisoning in households with young children. So vaping is not safe. Vaping will cause skin dryness and saggy skin. It will damage your oral health. Remember, I spoke about oral health not so long ago. It is likely to give you cancer. Let me get into this one of cancer. Vaping juices are filled with a variety of solvents like propylene glycol and glycerine, as well as metallic, guys, as well as metallic particles like chromium, cadmium, and lead. Remember what did I say about lead very recently? When heat is applied to them, they form new unknown compounds, which are likely to be aldehydes. So let's just say it's just a bad thing all round. Whew, it does. And then vape clouds are aerosols, not water vapor. So concerning the heart disease, please as well, vaping. If you stop smoking and you switch to vaping, just stop everything. Cut. Just cut. Cut. Are we learning great leaders? Oh, our leaders like, don't worry, it's saved. You can come back when you're sharp. Thank God for that. So are we together, my leaders? It is now almost 10 to 8. What are some of the products that can help for heart disease? We've already spoken about the berry oil, right? Specifically, right now it's this berry oil that is on promotion, right? The buy one get one free. Hey, you see, now I'm giving you your customers. You remember that the cholesterol, the vaping, the smokers, all of them. In fact, everyone is your customer. You just need to know how to package it. You need to individualize the way you sell your product. I mean, you cannot go to someone who's sugar diabetic and talk about something else that's just, you know, you need to talk about what? Controlling your blood sugar levels when you talk to sugar diabetic patients. I hope we are together, right? And remember, one of the controllable risk factors, remember the 10? It was pollution. And remember, berry oil protects us from pollution. Remember, pollution has got free radicals that damage our bodies on a cellular level. Now are you taking this serious? Yes, pollution has got those free radicals that just get into our body and just take out all the good stuff and give us so many problems. All right. So berry oil, excellent, and it's on special. Obviously, our teas, all of our teas are excellent. All of our teas are excellent. God. Thank you, Leader Idris, or is it Idris? I don't know, Idris or Idris. I'm thinking Idris. What's his name? Idris Alba. Yeah. So pink tea, excellent, but be mindful. Pink tea is not for normal body weight. It's even written on the box. Remember, it's written caution, not intended for use by pregnant or nursing mothers and normal or underweight persons. It is normal that you may feel stomach upset 1 hour after drinking this tea. It's written on the box. So pink tea, not for heavyweight people who are big. You cannot give it to someone like SD Vivian. You cannot give pink tea to someone who's SD Vivian size. No, rather go for the other teas. Are we together? So pink tea, brown tea, excellent for the heart. Excellent, excellent for the heart. Do you know that we have a long reacher who who was, remember, heart disease is not about age. Remember, there are some who get it even before they are born, right? So there's a leader who got diagnosed with heart failure at the tender age of 23 years. She's now 28. Hello? Am I communicating? Are we together? And she drinks brown tea. She says it helps her. Brown tea, berry oil, and our cordyceps coffee. Are we together, my leaders? Or is it Monday? Is it Monday? I don't see. Come on, come on, come on, come on. Right. Brown tea, green tea, all of our teas, right? But remember, the pink tea is for big size people like Pulane, like myself, right? Um, Calcium is also excellent. Good, good, good. Calcium, remember, I don't like it quite class. Remember, calcium is also excellent for the nerve signals. It's normally given to hypertensive patients, right? So it helps them. We are together. Okay, wonderful. Lila Refila, I don't know what you wrote there. It's blank. It shows your name, but it's blank. Um, so it helps with the nerve signals. It also helps the heart to function properly. Calcium. If you need calcium now, I don't know. The other products I didn't put them here, but I'll just say them. Like our NutriV shakes, the blue and the pink, also good. Welcome, Leader Gloria. Welcome, Leader Gloria. And obviously, the alkaline pack up, you can never leave the alkaline pack up under any circumstance. Alkaline pack up also excellent for heart conditions and the others that lead to the contribute. Remember this illnesses that contribute to developing heart condition like the cholesterol, the hypertension, which is high blood, you know. Mm. And then the surprise one, but I think by now you know, ne? Afrosap is also good for the heart. Afrosap is also good for the heart. Oh. Mm? And it's jam packed with vitamin D. And remember, last week, what did I say? Vitamin D is needed by every cell in our bodies. We don't have a choice. All right. So, my leaders. And then the surprise one, remember diet? We spoke about diet. So that's where our NutriV shakes, our teas come in, supplements, right? The other one we spoke about omegas, okay, which is also in the berry oil. But our snake oils have the omega fatty acid, omega 3. That's the one that's needed by the heart. So yes, if you don't understand why this contributes to your heart health, it means you haven't been watching all of my shows. Yeah. Are we together, my leaders? Are there any questions? Are there any questions? Training is done. Are there any questions, my leaders? Is there somewhere where you need clarity, maybe? Are there any questions? Is there somewhere where you need clarity? And then what I'll do as well, or let me give you good news while I wait for someone to type a question. There's a website, okay? There is a website. Let me share this website with you. This website, World Heart Federation. It's a different website. Remember, I was reading from Heart Foundation. This one is World Heart Federation. You can go on this website and create. Yeah, Lidangao. When you haven't been watching my training. This website, you can create your own free posters. Yes, leader, you heard me correctly. Snake oil has omega 3 fatty acids. Please go onto that website and create your own personalized poster to create awareness about World Heart Day, which is coming up in 2 days' time. It's free to make that poster. So it's personalized. You put in your own picture. You choose your color. You can play around. Blue, pink. There's so many colors there. I made 2 posters yesterday. And then you personalize. Just write a message, right? And then send it out to your client. Remember, we need to put our finger on the pulse. We need to be relevant. Okay, so go on that website. Please create your own poster. It's free. You can create as many as you want. They don't charge you. And just send it out to your prospect. Just put it on your social media. Put it everywhere. Hopefully you'll do one with you wearing something that says Long Reach, because remember, you're also a distributor. You need to put yourself out there as a distributor who is also relevant. And then the website that I was reading from, let me just copy and paste it for you on the Stop Vaping. But that's where I was doing this training about the heart and everything. You'll find everything there. Remember, we need to be relevant. We need to be very, very relevant. Are there any questions? Questions, my leaders? Let me just do this for, I know other people, they say they struggle. So I'll send this one as well, where I was actually reading. Okay, my leaders, I don't see questions. Leader Idris, I don't know what you type, but it doesn't show. All right, my leaders. Yes, how does snake oil help? Leader Ngao. Leader Ngao. Okay, let's do this. So snake oil helps in this manner. Anything that you put on your skin, it seeps through your skin, it permeates your skin, goes into your bloodstream, and the rest is history. Hence, I said even last week that we need to be mindful of the kind of products that we use. We are so fortunate to have long reach organic and ISO approved products. All right, so that is why. So that's how the omega 3 sits in, goes through your skin, goes to your bloodstream, and it travels to all the organs and your cells. Right, that's why you need to be very careful of what you put onto your skin. Very, very careful. We don't just put anything on our skin. Thank you so much, Leader Tanya. Are there any more questions, my leaders? I think I only saw one question. Sorry to disturb. We are told the substance for producing the snake is fat extract from snake. Does that mean omega-3 can be found in some snakes fat instead of fish? Leadership, you can, it's not only fish that has omega. It's not only fish. Even cordyceps coffee has them. All right, it's not only fish. Yes, snake oil is made from snake fat. It's extracted there. It's not made from the snake skin. You know, there are other people who say, no, I don't want to use this. Yo, they're thinking like myself. I must be honest. When I saw snake oil, I was like, I'm gonna put on snake skin on myself. Then when I researched, I'm like, oh, snake oil is made from snake fat. From snake fat. Yes, Leader Gloria. I'm happy that you do your homework. You must do more of it. Ladies and gentlemen, it's 8 o'clock. Can I love and leave you, or is there one last question? I will stop at 20:01. So you have a few seconds to type your question. Any question? Oh, remember, Leader Gloria, the omega is also in, I'm going to say, berry oil. Our berry oil has omegas 3, 6, 7, and 9. Okay, the berry oil is very potent. That's why everybody needs the berry oil. If you never tried berry oil, I don't know. And women are higher risk after menopause of developing heart disease because the estrogen goes low. So women take the berry oil or the beauty dreamy capsules, which is menquin. All right, take the berry oil. Women that have menopause or are close to, please supplement with the berry oil or the beauty dreamy capsules. All right, to minimize your risk of developing some heart disorder. Ladies and gentlemen, can I thank and love and leave you? It's now 2 minutes after 8. So we will talk some next week Monday. And yeah, I hope you learned a lot. Thank you so much, great leaders. We'll see each other on next week Monday, all right? Same time, 7 o'clock. Thank you so much. God bless all of you.